The Health Watch this morning, thanks in part to the work of comedian Jon Stewart and some big help from Capitol Hill, Americans are starting to get a better understanding of the dangers that our servicemen and women were exposed to from things like toxic burn pits while serving overseas. But at the Center for Deployment-Related Lung Disease, which is at National Jewish Health in Denver, they've been aware of that problem and they've been fighting the problem for years.
Nice and tall and make a nice tight seal around that mouthpiece. What I'm going to do is go ahead and get the test started.
Dr. Cecile Rose and her team are testing Air Force veteran John Sepulveda, who's had a constant cough and sicknesses since returning from Afghanistan in 2011.
Are you comfortable like that?
Uh-huh.
Fantastic.
We began getting phone calls from people in around 2010 describing respiratory symptoms and not understanding what was going on.
What was going on was bronchiolitis, an inflammation of the very small airways in the lungs. And it wasn't just coming from the fumes of toxic burn pits. Dr. Rose said there were other causes.
They talk about exposure to sandstorms that are extremely intense.
Some sand particles are just too fine for masks or even the lungs to clear out. And Dr. Rose said they can also contain toxic heavy metals.
They are extremely small, less than 2 microns in size, really get down deep into the lung and are not adequately cleared by the cough mechanisms or the mucus that, helps us keep our lungs from being overwhelmed by dust.
The team is using a non-invasive test called the Lung Clearance Index to diagnose bronchiolitis without needing surgery to biopsy tissue.
So it's a very simple breathing test. It's almost like doing a regular office kind of spirometry breathing test.
It's a great step forward, but Dr. Rose said a lot more needs to be done.
Now it's time for us, I think, to focus on treatment options. There really are no good, validated, evidence-based treatment options for deployment-related bronchiolitis.
And that's where the PACT Act comes in. Erica is going to tell you more about it in a second, but in short, it is a massive expansion of coverage by military benefits for deployment-related injuries. And Dr. Rose estimates there's about 11 respiratory illnesses covered within that act. Dr. Rose called that a huge step forward.